Do I need any shots for my trip? Do you ever have patients ask you that question? Do you know where the best, easiest, most reliable place is that you could go to get the answer to that question? Hi there. I'm Dr. Nancy DeRubo, a family nurse practitioner, and I have a certificate in travel health. Open up your favorite browser, and in that browser type cdc.gov/travel. And this is where you'll come to. This is the CDC Travelers Health section, and you will see that this says Vaccines, Medicines, and Advice. And there are two sections. There's one for travelers, and there's one specifically for clinicians. We're obviously going to focus on the side that's for clinicians. What you're going to focus on too is the traveler destination. And right here you see select one, and you see the drop-down box, and when you push that arrow, you're going to get a listing of pretty much every country in the world, and you just scroll down and choose the country that you want. For demonstration purposes, I'm going to show you the Dominican Republic, since I see a lot of patients who travel down there, and we'll use that as our example. So select your country, and then right below this, once you do, you'll see a green box like this, and you click on Go, and this is where you'll come to. The health information for travelers. Now this information is specific to the Dominican Republic, and this is the clinician view. You have a map of the Dominican Republic, and in this section you're going to see an area that talks about vaccines and medicines, which is what we're going to focus on, but you're also going to have information on non-vaccine preventable diseases, patient counseling, suggestions for a packing list. The other really important section here is the travel health notices, because sometimes this area will update more often than the CDC updates the vaccines and medication section. So when you scroll down, the very first section is this vaccines and medicines, which you can see a little bit of the tip of right down here. So let's scroll down. And here's the section for immunization information for people traveling to the Dominican Republic. You're going to want to consider routine vaccines, what vaccines are recommended for travel to the Dominican Republic, and check to see if there are any required vaccines for travel to the Dominican Republic. In an ideal world, all adults would be current with their routine immunizations. But since we don't live in an ideal world, this is a great opportunity for you to update your patients with their routine immunizations. If you're not sure about the most current schedule and the CDC recommendations, you can click right here and go to the immunization schedule for adults, and this was updated in February of 2018. The flu vaccine is probably, to me, one of the most important of all of the vaccines on this list, and it is considered a routine vaccine, but it's also an extremely important vaccine for people who are traveling. Flu is a year-round phenomenon in the tropics. So once you've established that their routine immunizations are current, the recommended vaccines consist of hepatitis A, and hepatitis A will probably be recommended for most travelers because it is contracted from contaminated food and water from the fecal-oral route. The hepatitis A vaccine is a series of 2 vaccines. And if you need more information about it, you can click right here and it will take you to the hepatitis A section of the Yellow Book. The Yellow Book is free online through this hyperlink. And the Yellow Book, in case you don't know, is the CDC recommendations for international travel. And then there's dosing information. It's important to note that while hepatitis A is a series of 2 shots, the first shot gives the majority of the protection within 2 weeks for this trip. The second booster just helps to make sure that it will last 10 years or more. The next vaccine to talk about is hepatitis B, and not everyone traveling to the DR will need hepatitis B. Only those people who will be at risk, not only based on the destination, but their activities. So if they're going to be at elevated risk because of unprotected sex, IV drug use, have any exposure potentially to any emergency medical care, contaminated transfusions, exposure to human blood in the DR, and certainly people who are going to get tattoos or body piercings would have exposure to blood and other body products. So if you have time and if it's feasible, certainly immunize your patient for hepatitis B, but the traveler who's going to an all-inclusive destination for 5 to 7 days who is not going to engage in activities that will expose them unwantingly to blood and body products may forego the hepatitis B. Malaria is a medication on this list. We're not going to talk about that. We're focusing on immunizations. The next one on the list is rabies. Rabies pre-exposure vaccine just primes the pump so that if someone has a rabies exposure, they don't need rabies human immune globulin, they just need boosters of the vaccine to be protected from rabies. The issue with the Dominican Republic is if someone has not had pre-exposure rabies vaccine and they do need human rabies immune globulin, there is none on the island of Hispaniola where Dominican Republic and Haiti are. So if someone who's not had pre-exposure rabies vaccine has exposure, and the majority of exposure on this island is dogs, if they get bit, scratched and it draws blood, or even get licked if they have a cut, say on their hand like a hangnail, they could be at risk of exposure to rabies. What they would need to then do is to go back to the United States where human rabies immune globulin and proper treatment is available. The reason we don't routinely immunize with pre-exposure rabies vaccine is the cost. In my clinic, it runs, and it varies, but it's around $350 to $375 per dose, and 3 doses are required. Many insurance companies do not cover it. For more information on rabies, here is the hyperlink to the Yellow Book for further information. The other vaccine that most of your travelers who are going to go to the Dominican Republic will want to take is the typhoid vaccine, because this too is from contaminated food and water. The typhoid vaccine does come in 2 different formulas. There is an oral formula that lasts for 5 years, and there's an injectable formula that lasts for 2. And here are your hyperlinks so that if you want further information. So in summary, it's really quite simple. Go to www.cdc.gov/travel, look at the clinician site, choose what country your patient is going to on the drop-down box, click Go, and here you will have the specific information and recommendations for travel to the country that your client is going to. This is a start, and it gives you the basis of the information so that you can answer the question, what shots do I need when? Oh, and by the way, I just wanted to be clear that there are no required vaccines for travel to the Dominican Republic, which is why they weren't listed. Sometimes patients do get confused. They think that they only need something if it's required, and if it's only recommended, they're not going to go with it. It's important that you do advise them that anything that is recommended is to protect their health and well-being when they travel. Requirements come from the countries you're traveling to. They're legal requirements and are usually more concerned with public health than the individual's health. So be sure and be clear about that. Here at Beacon Continuing Education, at www.beaconceu.com, we offer a variety of online continuing education programs. We offer the comprehensive course in travel health. We have a module on understanding adult immunizations, hepatitis A, and one module on typhoid vaccine. And you may be really interested to watch the video called New and Emerging Infectious Diseases. Thank you so much. I hope you found this information to be helpful.